Hello guys, welcome back to my channel, Your Challenge with Susie. So today we will be discussing personal disorders. However, this channel discusses lifestyle, causal factors, and ways of coping. We have two guest presenters with us today who will help us to understand what personality disorder is and some treatments. But first, let's get into watching a video.
All rise for Honorable Judge Smith.
This court is now in session. Today we address the case of Miss Miller, who stands accused of assault. Miss Gates, you may proceed.
Thank you, Your Honor. Ladies and gentlemen of the court, jury, I am here to shed light on the circumstances surrounding Miss Miller's actions. Miss Miller has been diagnosed with personality disorder, and today I aim to demystify the myths and beliefs surrounding this condition. Your Honor, personality disorders are often misunderstood. They are not an excuse for violent behavior, but they can contribute to an individual's struggles with emotional regulation and interpersonal relationships. Miss Miller's actions must be seen in the context of her mental health.
Please elaborate, Miss Gates.
Miss Miller has been diagnosed with borderline personality disorder, otherwise known as BPD. People with BPD often experience intense emotions and have difficulty maintaining stable relationships. It's crucial to recognize that they often face internal turmoil that others may not comprehend.
And how does this relate to the incident in question, Miss Gates?
Your Honor, the altercation occurred during a heated argument between Miss Miller and her colleague. Miss Miller's intense fear of abandonment and perceived rejection triggered a reaction that escalated into physical violence. It's important to understand that individuals with personality disorders can struggle to manage and maintain their emotions in stressful situations.
Whenever they mean to hurt anybody, me just did feel so overwhelmed.
Thank you, Miss Gates. Thank you, Miss Miller. Sorry, Miss Gates. What treatment plan do you recommend for Miss Miller's condition?
Your Honor, with proper therapy and support, individuals with BPD can learn effective coping mechanisms and improve their interpersonal skills. I propose a combination of dialectical behavior therapy and counseling to address the underlying issues contributing to Miss Miller's struggle.
Very well. Miss Miller, the court recognizes the importance of addressing your mental health. You will be mandated to attend a therapy session as part of your sentencing.
Thank you.
It is essential for society to move beyond the myths surrounding personality disorders and recognize the need for empathy and support for those struggling with mental health challenges. The defendant is sentenced to 5 months of mandatory behavioral therapy with monthly reports to the court. This court session is adjourned.
So as was seen in the video, the defendant is struggling with personality disorder, and our guests today will help us to bring awareness. So, Denver?
Thank you, Susie. So based on the video itself, it really talks about what personality disorder is. And based on research, what we have found out is that personality disorder is a mental health condition characterized by persistent, inflexible type of patterns of behavior, which tends to deviate significantly from cultural expectations, leading to chronic interpersonal and identity type of issues. It's also important for us to note from the video, to know about personality disorder on a whole, is that it has to do with history, and it's dating back to 400 BC, where early observations of body fluids would have indicated some sort of personality disorders. And in 1835, where Pritchard coined the term mental insanity to describe antisocial type of behavior without intellectual impairment. However, it was not until in early 1923 when Chandler's classification contributed to a modern type of understanding of what personality disorder is. And recent research would have indicated that it's both the genetic and environmental factors that would have really influenced personality disorder. It's also very important for us to look at the clinical features of personality disorder, and this is where we look at personality disorder being persistent, stable, long-lasting type of behaviors with significant distress and other impairments such as cognition, where it affects your interpersonal relationship and impulse control, and it results in distorted, inflexible patterns of patterns of behavior, and can be attributed to most likely recent type of stressors. Based on DSM-5 classification, it really puts personality disorder into three categories rather, clusters A, B, and C, and this is because they have shared features, and we rely on these clinical criteria to actually diagnose persons for personality disorders. The common symptoms based on the DSM-5 include, distorted self-image, impaired empathy, rigid coping mechanisms, maladaptive interpersonal skills, and it's very, very common for persons to misdiagnose persons because some of these personality disorders overlap with other mental disorders or normal personality variations. Susie, it's also very important for us to know that it's not just a Jamaica thing when it comes on to personality disorder. It's also, affecting persons globally, where in the US, 7.8% of the global population would have experienced some type of personality disorder. And in Jamaica, where 26.4% of the population meet the criteria for disorder, and 10.3 met for the particular disorder being personality disorder. And there's a very high comorbidity between different clusters when it comes down to personality disorder, which makes them very difficult to kind of distinguish, and for them to have for persons to really diagnose persons properly. But further studies will help to hinder misdiagnosis. Susie.
Well, thank you very much, Denver. Roxanne, could you tell us a little bit about the clusters?
Hello, Susie. Thanks a lot for having me on your wonderful channel. So there are 3 clusters of personality disorder, which Denver had said not too long ago. So first we have cluster A, right? So cluster A consists of paranoids, schizoid, schizotypal personality disorder, right? So individuals in this cluster, right, they display unusual behaviors such as distrust, suspiciousness, and social detachment, and often come across as odd. So the next cluster that we have is cluster B, which examines histrionic, narcissistic, antisocial, and borderline personality disorder. So Susie, individuals with this cluster, right? Cluster B, they are normally dramatic and emotional, and they even are erotic as well. Now we have cluster C, which is the last cluster, right? Which examines avoidance, dependent, and obsessive compulsive personality disorder. So they display anxiety and fearfulness, and they have characteristics that aren't seen in the other 2 clusters, which are cluster A and B, right? So Susie, a great causal factor is also their environment,
Thank you for, taking us through the clusters, Roxani. So I know a little bit about it, so I think I can help my subscribers to get a feel of more in depth You know what I mean. So now, sociocultural causal factors. So, sociocultural causal factors contribute to personality disorders. So, with cultural variability and universal personality traits, however, prevalence varies across culture. So, Western cultures may have more prevalence of certain disorders, while ethnic and racial disparities also exist, with borderline and schizotypal disorders higher in certain groups. So, personality disorders are medical conditions influenced by biological and environmental factors, as was stated by our guests, often resulting from childhood trauma, but they can be and can lead fulfilling lives. So, moving on to treatments and outcomes. So, personality disorders are challenging to treat due to their enduring patterns of behavior and inner experiences. So, treatment goals include reducing distress, changing dysfunctional behaviors, or changing the entire personality structure. So, therapeutic techniques must be modified to address underlying schemas. So, now we're going to move on to antisocial personality disorder and psychopathy. So the DSM-3, which was first introduced in 1980, includes antisocial personality disorder, also known as psychopathy or sociopathy, a term or terms we are all familiar with. So this disorder characterized by deceptive, aggressive, and antisocial behaviors is linked to genetic factors, temperamental traits, fear and anxiety deficiencies, emotional deficits, and early learning of antisocial behavior. So despite its challenges, cognitive behavioral treatments like self-control, victim awareness, anger management, and drug addiction offer effective approaches to change antisocial behavior. So I hope our little synopsis of personality disorder has us all wondering, wanting to go and dig deeper into the topic so we can all spread awareness about personality disorder. So now I hope we have all grasped the importance and understanding of this disorder and look into ourselves before causing someone distress. Hey guys, this brings us to the end of today's video. Remember to like, share, and subscribe. And listen to this poem as we end. I'll see you next time. Stay safe and be kind.
Personality masquerade. Personality disorder, a mental illness masquerade, where clusters A, B, and C comes out to play. DSM-5 spots their luminosity, then diagnosis specifies. Cluster A, a suspicious soul takes a vacation to distrust and being alone. In the corridor of their mind, oddity you will find. Cluster B, a spotlight seeker, drama and destruction they acquire. Like a painting on a wall, they must be admired. They believe that they are the king or queen, so they must be honored. Cluster C trembles like a leaf in the middle of a stormy weather, allowing fear and avoidance to do whatever their heart desires. Biological and environmental factors present themselves, creating unwanted desires. Childhood memories knocking on the door. If you open, trauma will walk right in without an order. Psychology curtain, spun and frayed in the complicatedness of minds, patterns are gained. Personality disorder, an unforgettable year, a harmony of struggles, complex and fierce. Yet, inside the darkness, a glimmer of light, hope unrolls allure wings attractive departure. Therapeutic close contrive a restorative adapt, a chance for recovery, a protected school.